Hi everyone, so today we are going to learn about posterior part of norma basalis. In the previous videos we have already seen anterior and middle part of norma basalis, and now today we will be learning about the posterior part. So again, as we have seen in middle part of norma basalis, we had divided it into median part and lateral part. Likewise, in today also in posterior part of norma basalis, we will be dividing it into two parts, that is the median area and the lateral area. These two lines depicts the structures which are present between these two lines come under the median area of norma basalis, posterior part, and the rest is the lateral area of posterior part of norma basalis. So in the median area of posterior part of norma basalis, there are basically three important structures. First is the foramen magnum. So this foramen, this is largest foramen in the skull base. This is the foramen magnum. It is roughly oval in shape and it is broader posteriorly as compared to anteriorly. Then this foramen upwards, it is continuous with the posterior cranial fossa, and downwards it is continuous with the vertebral canal. So basically it allows the spinal cord to go up in the posterior cranial fossa, and it becomes continuous with the medulla oblongata, which is the posterior most part of the brainstem. So this is the main function of foramen magnum. Apart from these, there are certain other important structures which we'll be learning when we learn about the foramens of the skull base. So this is foramen magnum, and anteriorly it is bounded on both sides by two occipital condyles. So this structure, this bony projections, these are the occipital condyles. So this is foramen magnum. Then there is external occipital crest. So this bony projection or elevated line which starts from the posterior boundary of foramen magnum up to the external occipital protuberance is the external occipital crest. So this elevated bony projection is the external occipital crest, and then this external occipital crest, it gets ended into the external occipital protuberance. Here is a bony elevation which is present in the back of the skull, and we have already learned this in the norma occipitalis, that there is a bony elevation which is the external occipital protuberance. So from external occipital protuberance, two nuchal lines, they run towards the lateral side. These are the superior nuchal lines. So this is the superior nuchal line, and this one is the inferior nuchal line. Inferior nuchal line originates from the middle part of external occipital crest, and the superior nuchal line, it originates from the external occipital protuberance itself. So this is all about the median area of posterior part of norma basalis. Then coming to lateral area of posterior part of norma basalis. So first of all, the first structure we'll see in the lateral area is the occipital condyles. These are the bony projections which are present in the occipital bone. They are roughly oval in shape with their long axis directed forward and medially, and they articulates with superior articular facets of atlas vertebra, and so they help in forming the atlanto-occipital joint. So these are the two occipital condyles. The next structure which is seen is the hypoglossal canal or the anterior condylar canal. So here in the antero-superior aspect of occipital condyles are two small openings which are the hypoglossal canal. They are present anterior-superior to occipital condyle and directed laterally and forwards. So the function of these hypoglossal canal is, or the anterior condylar canal is, they transmit the hypoglossal nerve. Then secondly, behind these occipital condyle, there is a depression in the occipital bone, this depression which is called as occipital fossa or the condylar fossa. In this condylar fossa, there is an opening which is called the condylar canal or the posterior condylar canal. So they are present in the condylar fossa behind the occipital condyles. So these condylar canals, they basically open superiorly into the sigmoid sulcus, and they carry emissary veins to and carry them to the sigmoid sulcus. So this is the condylar part of occipital bone. Next is the jugular part of occipital bone. So this process, these are the occipital condyle, the hypoglossal canal, and the condylar canal. Next, we'll see in this diagram that there is a foramen between petrous temporal bone and the occipital bone. So this is the petrous temporal bone, and this is the jugular process of occipital bone. This. So this jugular process of occipital bone, and between the petrous temporal bone and it, there is a foramen which is called the jugular foramen. Here and here. So this is the jugular foramen which is present lateral to the condyle and in the posterior end of petro-occipital suture. This foramen is present, which is called as the jugular foramen. It is elongated in its long axis and it is directed forward and medially. Then behind this jugular foramen, there is a fossa in petrous temporal bone. This fossa. This is called as jugular fossa. So this is the jugular fossa and this is the jugular foramen. Jugular fossa is a part of petrous temporal bone and there is a depression in the petrous temporal bone behind the jugular foramen which is called as jugular fossa, and it is larger on right side as compared to the left side. This is the condylar canal as we have already seen, and the mastoid foramen which is present in the mastoid process of temporal bone. So this is the jugular foramen and this is the jugular fossa. This canal which is present in the petrous temporal bone, as we have already seen in the medial part of norma basalis, is the carotid canal. So between at the lateral end of this jugular fossa, here is a small canal which is called as the. Now first we'll see what all structure are present in the jugular, they transmits from the jugular foramen. So there is internal jugular vein and three important cranial nerves, that is the glossopharyngeal nerve, vagus nerve and spinal accessory nerve. These three nerves also pass through jugular foramen. And now we'll come to the mastoid canaliculus. So at the posterior end of foramen, there is a fossa which is, we have already seen, is the jugular fossa. This jugular fossa, basically the clinical importance, it lodges the superior bulb of internal jugular vein. So it lodges the superior bulb of internal jugular vein. Then at the lateral wall of this jugular fossa is presence of a small canaliculus or canal which is called as the mastoid canaliculus. The function of this mastoid canaliculus is that it transmits the auricular branch of vagus nerve. Then near the medial end of this jugular foramen, here at the apex of the jugular notch, this is the jugular notch which is seen in the occipital bone. At the apex of this jugular notch and in the anterior or the medial end of jugular foramen is presence of another canaliculus, and this canaliculus is called cochlear canaliculus. So basically it contains the perilymphatic duct which is important for maintaining the balance of inner ear fluid pressure. So here is presence of cochlear canaliculus, this structure, and it lodges the perilymphatic duct so that the balance in the inner ear fluid pressure can be maintained through this. And lastly, between this jugular fossa, which is a depression in the petrous temporal bone, and the lower end of the carotid canal, here is a small bony projection or a um, small thin edge of bone which is seen here. So here also there is presence of a canaliculus which is called as tympanic canaliculus. So tympanic canaliculus, it transmits tympanic nerve which is the branch of glossopharyngeal nerve and inferior tympanic artery. So it transmits three main structures. So as we have already seen that at the lateral end of jugular fossa there is a canaliculus which is called as mastoid canaliculus. Then at the medial end of jugular foramen or the apex of jugular notch, there is presence of another canaliculus which is called as the cochlear canaliculus. And between the lower end of carotid canal and jugular fossa of the petrous temporal bone, there is one more canaliculus which is called as tympanic canaliculus. So with this is the jugular part of the posterior part of norma basalis, and lastly there is squamous occipital bone. The whole structure which is remaining here is the squamous occipital bone, and it is marked by superior and inferior nuchal lines. So this is all about the posterior part of norma basalis. We have seen that in the median area there is presence of foramen magnum, external occipital protuberance, external occipital crest and external occipital protuberance. In the lateral area we have seen occipital condyles on both sides. Then we have seen condylar fossa here and here, and within this condylar fossa there is presence of condylar canal on both the sides. In the anterior superior aspect of occipital condyles there is another canal which is the hypoglossal canal, which helps in transmitting the hypoglossal nerve. And then we have seen that there is a jugular foramen which is present between petrous temporal bone and occipital bone. So this jugular foramen, it helps in transmitting internal jugular vein, glossopharyngeal nerve, vagus and spinal accessory nerve. Behind this jugular foramen there is a depression in the petrous temporal bone which is called as jugular fossa. At the lateral end of jugular fossa there is presence of mastoid canaliculus. At the medial end or apex of jugular notch there is presence of cochlear canaliculus, and in a thin bony edge between the carotid canal and jugular fossa there is another canaliculus which is called as tympanic canaliculus. So with this we have come to an end to all the important structures which are seen in norma basalis, and in upcoming videos we'll again revise all the foramen which are present in norma basalis and what all important structures pass through them, and also we'll be learning about the muscle attachments of the norma basalis. Thank you so much.